Hi there. I'm here today with Sebastian Hamilton, our Associate Chief Pharmacist. Sebastian's responsible for our outpatient pharmacies, and I wanted to understand a little bit about the work we're doing to make sure that during COVID-19, our patients and their families can get access to the medicines that they need. So can you talk a little bit about how pharmacy's been preparing and what specifically we're doing on the ambulatory side of our pharmacy?
Sure, Kate. Thank you for having me. I think it's just a great opportunity to really connect more with our patients. We've been there for them for years now in the traditional retail pharmacy space where they walk into the pharmacies and have their prescriptions picked up. One of the things we've been doing now with the whole COVID epidemic is really driving a lot of volume into our mail order pharmacies. And we find that to be very successful from a number of standpoints. We're finding that patients love the fact that their medications are arriving at their doorstep by United States Postal Services. And more importantly, we make those outreach calls proactively and ongoing to make sure the patients know that we are here for them. In fact, I received an email from a patient advocate that a patient was worried about not receiving one of her medications during this whole epidemic, and she began to proactively call other retail pharmacies. Well, before she had an opportunity to do that, we called her and offered her a 90-day supply of her medication.
Oh, that's true.
So those are the things that I think we're making a great impact on and having a lot of outreach with our patients.
Yeah, you don't think about it, but if you're a patient who typically comes to the hospital once a month or every 3 months to see your doctor and comes to a pharmacy or to one of our BMC pharmacies to pick up your medicine, and now there's a stay-at-home order, our solution to that has been a mail order pharmacy. So we didn't start that a month ago. So tell me a little bit about the mail order pharmacy and the work you've been doing. I had the opportunity to visit you in Braintree, so talk a little bit about that.
Yeah, absolutely. And it was great. So we've been doing it to some fashion on our on-campus pharmacies. You know, mail order to a patient here, mail order to a patient there, depending on their circumstances, just to make sure that they're more compliant with their medication. But back in 2017, we were fortunate enough to open up our mail order pharmacy, which is a 7,200 square foot facility with state-of-the-art automation that interfaces with all our pharmacies on campus. So one of the things we've been doing since that time is really driving a lot of volume into our mail order pharmacy just to stay ahead of the practice when it comes to patients receiving their medication. Because, you know, some of our patients are challenged. They cannot have readily transportation at their disposal. So we knew mail order was a good solution, and we really tried to fully load that facility with all the mail order prescriptions at that time in 2017 and 2018. Fast forward to 2020 during the COVID epidemic, it was just a natural progression. We've already been doing it, driving volume there, it's just now turning on to full tilt.
Right, and it's terrific. I had the opportunity to see it. I think of it, this is not a technical term, but kind of like a roller coaster ride for prescription bottles. Sure. And it's really a very impressive operation. And from that, we get data about the prescriptions people are taking, because it's one thing to get the prescription in someone's hand. We also need to know, are people actually taking their medications? So how do we track that?
Absolutely. So we have metrics that track how often the patient is getting their medications picked up to know if they're being compliant, specifically around the ACO members, the high utilizers. We want to make sure that they get the most attention so they can be the most healthier and not move from the second highest category to the first highest category of risk. And so what we do is intervene at that time, look at their compliance with their medication, and then have more interventions involved, whether it's a pharmacist or technician reaching out to the patient proactively, and then using the mail order pharmacist or delivery in a clinic or delivery via a courier service to make sure they can get their medications at their doorstep so they can continue to be compliant.
So Sebastian, it's terrific. It's inspiring that even in a pandemic, Boston Medical Center and its pharmacy staff are doing everything we can to help our patients get healthy and stay well. I want to thank you and thank your team, and I want to thank everyone for joining in today.